Hi, everyone. We have a great show. We have Amy Loper, the owner and nurse practitioner injector for Nouveau Facial Aesthetics. We get into all things injecting. We talk about Botox. We talk about fillers. We talk about her journey and what that looks like. And she talks about what it takes to preserve your skin. So I hope you enjoy. Thanks for listening.
This episode is brought to you by our sponsor, Warren and Dillon, the Midland's trusted personal injury lawyers. Here's some great advice from our sponsor.
Hey there, Brett Warren with Warren & Dillon. I wanted to talk to you today about some of the biggest mistakes you can make when it comes to dealing with insurance companies. I think one of them is giving a recorded statement to the insurance company. The problem is that the insurance companies, they're doing these recorded statements to help their case and to hurt yours. And so they're going to ask some sneaky questions that are designed to hurt your case. One quick example, they'll ask how many feet away you were from the other car when you first noticed them. Nobody really knows the answer to that. But what they're going to do is they're going to say, hey, you should have noticed that other car, and now you're 20% at fault. So do yourself a favor, just don't do it or talk to a lawyer first. Trusted advice, proven results, Warren & Dillon.
Hi, everyone. Welcome to Here for the Health of It. I'm Dr. Randy here with Dr. Tom. As always, we love that you guys are listening, commenting on our stuff. If you haven't given us a review or on Spotify or a follow on YouTube, we'd love it if you do that for us. And we have a great show today. We have Amy Loper, who's the owner of Nouveau Facial Aesthetics, and you're a nurse practitioner injector.
Yes.
All right. Welcome to the show.
Thank you so much. I also own the business.
And you own it. You're the owner.
Yes. Yeah.
And you've been doing this 2.5 years at this location or in this business, it sounds like?
Yes. So I started my business 2.5 years ago, and I've been injecting for 6 years.
Okay. Tell us about your very first one.
My very first patient.
Fell in love with it, yeah.
Well, I was actually a patient at a different med spa, and that's how I got into injecting. The injector at the time said that she felt I had what it takes. We had a bond. So anyway, she brought me in. I started injecting. My mom was actually my first patient. I remember I was so nervous with the needle, and I was injecting cheeks, so mid-face, and I actually bent the needle in her face.
No.
Dead serious.
How long was the needle?
I mean, it's like half an inch, but bent the needle in my
So you
mother's
hit the
face.
bone and then twisted?
Just kept
Yes. It was an injection to the bone, which it's supposed to be Juvederm voluma, but I actually bent the needle. So she was like, oh my gosh, this hurts. And so, of course, I don't know what I'm doing. Well, I don't know what I'm doing.
Yeah.
I'm just sitting there like, oh my gosh. And literally I pull the needle out and it's bent. Yeah, it's crazy.
How did she look afterwards?
She was fine.
She looked good?
It was my mom, so she was fine. She didn't care.
Do you want to give a shout out to the injector that got you into it?
Do you
or you want to
remember
keep that private? Or do you even remember who it is?
It was Beth Williams at the Essential Face.
Beth, great.
Yes. Yeah. So
She's great.
Yeah, she is. She got me into the business. I worked for her for several years. Very, very happy with that. Yeah.
Nice.
Always be appreciative.
What were you into before injecting?
Yes. So before injecting, so I've been a nurse practitioner for 10 years, nurse for 20. I've done trauma nursing. So I did, Richland ER, crazy stories there. Then I was in medical ICU. And then I taught for the University of South Carolina. So I was a clinical nursing instructor there while I was in school to be a nurse practitioner. I've worked with family medicine. So, I've, handed out all the antibiotics that people want for their viral illnesses. Yeah. And then I worked in geriatrics prior to being an injector.
Yeah, nice.
Everyone who's a nurse at Richland has stories about people putting weird things up their butt.
I have a story.
Yes.
I was hoping.
Yeah.
I have an object.
Yes. So that is a true thing. Like people do come in with that. I was working, we called it pods. They were pods back in the day. It was like pod 9, working EMS. This patient comes in, shampoo bottle up the butt.
Oh, God.
Yeah. So they had to go to surgery and all the things. It was pretty bad.
What'd they say? Like I slipped and fell in the shower?
They actually, yes.
No way.
They-
Not sure how it got up there, but
Yeah,
it's
they,
up there.
They slipped and fell, and there they are in the ER. Yeah.
Oh God.
What? So what did you say? Did you have a straight face or?
Yes.
Yeah.
Yeah.
You
I
just
mean,
said, "Oh, that must have been a
professional.
terrible
Like,
fall."
oh my gosh, I'm so sorry.
What are the odds?
So sorry
Like,
to hear
yeah.
that. Yeah.
This happens all the time.
Yeah. I mean, it's just one of those things.
All right. So tell us about the services that you got going on at
Yep.
Nouveau.
Nouveau. So let's see. I mainly do just injectables. I've dabbled with some laser treatments, radio frequency microneedling with Morpheus by InMode. But I find that my joy in injecting comes from just doing the injectables. So mainly Botox or Dysport. And then dermal fillers. So I do, Restylane or Juvederm fillers, and I really love that. There's an artistry that goes into injecting with the injectables, more so than that I find with laser treatments and the needling. So I enjoy the art.
Today's episode is brought to you by our sponsor, Columbia Family Chiropractic, with 3 easy-to-get-to locations, one in Forest Acres, which is by Trader Joe's, one in O'Neill Court by the DMV, and one in the Northeast by Sand Hills. You'll be sure to have somewhere near you. They offer a ton of services from corrective care, on-site digital x-rays, spinal decompression for bulging or herniated discs, dry needling for injuries, pediatric care, and a Class 4 laser. They accept all your major insurances. And if you mention this ad, you'll get a discount on your first appointment. Check out their website at cfc4health.com. or Google Columbia Family Chiropractic. That's CFC4health.com. So I was watching a podcast last week, and it was talking about how women are looking more and more the same because the beauty standards are kind of universal. You want symmetry, you want your lips to be the same way, you want bigger eyes, whatever. And because so many people are doing it now, there's kind of this push toward people looking the same, and they're thinking down the road, it's going to be uniqueness that is going to be the standout. So someone might come to you and say, hey, everybody's lips look like this. I want them to look totally different. Do you see that happening?
I do. Everyone comes in and they want to look like that Kardashian, or they want to look like, what the Instagram models, people like that. But what I try to do, what makes me different, is I like when my patients come in and I can point out that difference that they have, like what makes them unique, and let's highlight that. Like let's don't give you the lips like Kim Kardashian, and let's don't give you the big maleficent cheeks and whatnot. Like let's just bring out your uniqueness, because God made us all unique. We have our own beauty. We don't need to look like everyone else and conform to whatever that beauty standard is.
So can you think of an example of that? Because it didn't really make sense to me. Like I couldn't see a person wanting to have too big of lips or too small of lips, or weird lips. Everybody just wants the same. No,
they all want big lips. Yeah. Like that's the thing now. These young girls, like my USC students that come in, everyone wants the big Angelina Jolie, Kardashian lips. Like that's what they want. They just like they all want the blonde hair. So.
Okay.
Yeah. What about anybody wanting more lines, like more wrinkles?
Oh, anti-Botox.
They want the opposite.
Well, some.
Like some smile lines or something.
They do want to preserve.
Yeah.
Great question. So I have some patients that come in. So there's 3 or 4 now FDA indicated areas for Botox cosmetic. So we've got the lines between the brow, you've got your actual forehead lines, your crow's feet, and then now you have the platysmal bands.
You knew he'd do it.
Yeah, I knew. I'm sorry.
It's normal. Everybody starts moving away from
they get excited.
Yeah. And you got excited about more wrinkles.
I did. I get so excited to talk about this. And then, the platysmal bands. So I do have patients, great question, that come in that only want to be treated here, like on
just
the forehead.
Top side.
Yeah. So then they'll have these lines, and they're like, I'm proud of these lines. It shows people that I smile and I have a personality.
Yep.
And I agree with that. So when I do my assessment and patients come in, I'm able to look at them and say, well, what bothers you? Like I put a mirror in front of them and say, what bothers you? So if you tell me, this is what bothers you, and you don't, you're not bothered by your crow's feet, then let's leave them alone.
Yeah.
Yeah.
Are any women doing it for their husbands? Like, or is it like, is their husband sending them in?
Not really.
I could see Randy sending his wife in.
I was actually going to ask that question. How often does the husband come in and be like, hey, let's just fix these things right here?
Surprisingly,
marker.
they don't. Husbands actually say they don't want their wives to look different or change how
That's
they
the right
look.
thing to say.
Yes.
That's
Randy.
how my wife is perfect. So
Yeah.
I
Yeah.
feel,
But if you had
but
a
I'm sure there
marker
are guys out there who don't feel that way.
Well, a lot of guys, are nervous, when their wives say, "Hey, I'm going to go get Botox," or "I'm going to get lip filler,"
Yeah.
or get whatever, because they've seen bad work and they
Botched.
don't want botched.
Yeah.
I have seen botched.
Oh.
So they don't want their wives to look different. They love their wives for who they are.
And it's not cheap either.
Definitely
I think husbands
not
are more
cheap.
worried about
There's
that.
a little money.
Yes, well, it is a financial commitment, but it makes the woman feel beautiful.
Yeah.
Are you a proponent? Like, I've seen these things on Instagram where people are massaging faces to do like the same thing as Botox. Is that a thing?
Not
Like, they're
that I've
really
seen.
aggressively massaging faces.
I haven't seen
Oh, you
that.
haven't?
I haven't seen the science.
But it sounds nice, kind of.
Well, it sounds nice. Who doesn't want a massage on the face?
right.
I mean, you get facials, it feels great, but it's not going to, manipulating the muscle is not going to do anything like, with your
pushing,
hands.
yeah.
It's not going to do anything in terms of relaxing the muscle. You can do lymphatic massage where you can do lymphatic drainage and, you can look
Yeah.
refreshed and whatnot, but it's not going to affect your muscle movement.
Okay.
And there's less secrecy around it these days, I find.
Yes.
But I know back in the day, especially in the men's world, like The Rock saying and Mark Wahlberg saying, "I'm not taking steroids. I'm just doing this new protein shake," or I got this new thing that I do that with a bicep curl. That's how I grew 3 inches in my biceps. And I know that women do that to an extent. I'm just wondering what percentage you think pretend to be natural when they're not, and what percentage just own it and say, "Oh no, I get all this stuff done."
Honestly, now in 2025, I would say that most women own it.
Oh,
They own it. They are not gatekeepers of what they are doing. I will say, I have a few, smaller percentages, I guess, of women who don't want to go out and broadcast, "Hey, I've gotten my Botox
Right.
with Amy," or "I've gotten this or that." And I respect that. That's their decision. But really, for the most part, people are telling the world.
really? So
Yeah.
would it be okay then if you notice someone's lips are bigger to be like, "Oh, your lips look nice"?
Yes.
Oh,
I think that's fine. I mean, you want them to notice.
Yeah.
You do the work. You get the work done.
Now I'm gonna throw something out that I heard on Bravo Television,
Oh,
and I don't know.
gosh,
You might. I'm gonna see if you do this at your place.
Okay.
It's called Scrotox. It's Botox in the scrotum. Is that are you seeing this? Like, is this what dudes are getting into? And why would you do that?
Well, I haven't heard about it in the scrotum, but I've heard of hole tox.
Butthole?
Yes, around the actual butthole.
Now, what's that? Talk me through that.
Well, I will tell you now. Let me just say, I do not offer this at
don't-
Nouveau
okay.
facial
Okay.
aesthetics.
Just pure information then.
Pure information. I have seen hole tox. It is to relax the sphincter. So I do know that you can do it for medical reasons.
Wouldn't you just shit yourself?
You would, but I think you have to dose it correctly
gotta
with
get
the
it right.
the appropriate amount of units of Botox. But it relaxes that sphincter to just make things
it's more. I'm
little
assuming,
easier.
I'm
To
assuming
put a
it's more
shampoo
for.
bottle in, maybe.
I mean, yes.
It's not for aesthetic purposes.
It's not
probably.
not aesthetic.
Yeah.
You can also put filler to enlarge your male parts as well. That's
Weird.
another thing.
Longer or thicker?
More girth.
Girth has been
yeah.
a thing.
Yeah, we've been hearing about that a lot.
Again,
It's a
On
big
this
thing.
show.
I mean,
Just because
yeah.
we ask it every time.
Yeah, it's nothing that I offer. So listeners, I don't do that. But
There's not like a side door where you're like, all right,
there's
this
no
is where
side door. But it is a thing. So
Okay.
yes, there's hole tox, and then there's filler for
I'm surprised by the whole tox. That's
It doesn't make sense to me.
well.
it's certain.
Yeah, it's a thing. My face is so red.
Okay. Is there anything else, guys? Is it guys doing that or girls? I guess that's
The
probably.
whole talks?
Yeah.
Guys.
Guys.
Oh,
Yeah.
Wow. Is there anything else that the guys
that was a
are doing?
surprise. I thought it was, yeah. All right.
Yeah, no.
I mean, I guess a girl could.
Yeah.
But it's
Yeah.
mainly for
For
men.
guys. I get it.
Yeah.
Yeah.
Is it-
I mean, you just get visuals. That's the
it's too
problem with
much.
this show. I just get visuals and I can't hold it together.
But there are Instagram accounts that you can look up.
And
But-
see it?
Well, I don't think they show it, but
Okay.
they discuss whole talks.
And it's spelled H or like
Like a whole.
WH?
No, whole.
Like a whole.
Mhm.
Okay.
Yeah, whole talk.
So you can pretty much get Botox in any muscle in your body,
Yes.
other than your heart.
Mhm.
Do people get it in their tongue?
No.
No.
No, they don't do that. I mean, women can, I mean, you can also use it for medical reasons. You know, if patients have, like a neurologist can see patients for migraines and different things. And like a urogynecologist can do it for bladder spasms, different things like
Yeah.
that to kind of help women with incontinence and different things. So
What about like extreme sweating, like sweaty palms and
Yep.
stuff like that?
you
could
can do that. Mhm.
Really?
So yeah, hyperhidrosis under the arms.
Yeah.
You can dilute down that Botox and place it. It lasts for about 6 months. It keeps you from sweating. A lot of patients who are doing business meetings and different things, and they're sweating through their shirts. Love that, so they don't have the sweat stains. Or yes, you can do it for the hands
Yeah.
as well.
A sweaty handshake's probably one of the worst things
Yeah,
out there.
Well, so,
I mean, it is.
but I mean, there's some people. There's nothing you can do, I guess,
Yes.
other
well,
than you just
now
you would Botox your
Just get
hands.
Botox in their
or wear a
hands.
glove.
Yeah,
That's-
yeah.
Hold on a second, and you go. Whoosh. Good to meet you.
That's true.
So one of your reels that I saw that I thought was really funny was you were like getting ready for a day of Botox and filler after buying all my organic groceries this morning.
Oh yeah, yes.
So how do you reconcile? Because it sounds like you're organic, holistic, health minded, and then there's this side of it, which growing up, the botulism toxin, I was like, my dad scared me to death of it. Like if you had a can that was a little bit over, or any food that was out, I mean, he'd also like grill a burger to the point where you could you could barely eat it anymore. So he was just like terrified of anything like that.
Yeah.
So what does that look like for you as you like kind of do both sides of the spectrum?
Well, everything's okay in small doses, I believe. It has been significantly studied. You're only getting such micro doses of that botulinum toxin A in the Botox, so it's very safe. It's been around for 25 years. So no, I don't have issues with that. I mean, we kind of have to have a balance here. Yeah. I mean,
Well, and I think I would assume that it's getting better and better over time too. Like over 25 years, 25 years ago, the dosage may have been less calculated. I don't know. I'm
Yes.
guessing.
because they were trying to figure out like what is this doing when it is injected into that muscle, exactly how many units need to go where. So there's just, like I said, there's been a lot of studies. Botox has actually been the most widely studied because it is the pioneer of all of the cosmetic injectables for your toxins on the market. So there's lots of different ones. I mean, I personally only carry 2 portfolios in my practice. So I carry the Allergan portfolio, and then I carry Galderma, which is the maker of Dysport. But then there's like Daxify and Xeomin and Nouveau, and then there's some new Botox. I don't know, but I only carry 2.
So would you say that Botox is the most studied?
Yes,
And
25
then
years.
what would be the least studied?
Probably this new one. I don't even know the name of it. It's so new. And then I know Daxify is one of the other newer neuromodulators on the market. But yeah, Latibo or something like that, I think is the name of it. But I'm not gonna bring that into my practice. No.
It's too new.
Well, it's too new, but I mean, I know I don't know. I just want safety, and I want the most studied.
Right,
So for my patients, I want to be as safe as possible. So Botox, Dysport, and we'll kind of stop at that.
And what about fillers? How long have they been around and studied?
Well, that's a great question. I actually don't know, and I should know because I'm an Allergan trainer with Juvederm. But no, I'm not exactly sure. I can't remember the amount of time, but Juvederm's kind of been on the market one of the longest. I think there was Bolotero at one point, but I'm not as well versed in terms of how long that's been around. But With filler, they make the different portfolios make different fillers for different parts of the body, or on the face, excuse me, where, you'll have different consistencies or, the amount of HA, and kind of the properties that it brings. So like, what is the water affinity? Like how much water is it going to bring in? How much, lift is it going to give on the periosteum when you place the filler? So
that, and some of them are more easily dissolvable than others, is my understanding. I know so much about this because Beth taught me a lot of it.
I mean, yes.
So when a person decides what type of filler they want, is there something that says, well, this one will look better, but it's less easily dissolvable. This one doesn't look as natural, but you can dissolve it easier, or maybe it doesn't last as long?
What I try to look at is when I put the filler in, I have to determine what are the patient's goals and what can I do for the patient. So for that, I have to make the decision. Like for mid-face and the cheeks, I know that my go-to is going to be Juvederm Voluma. It is going to give me that nice natural look. It's going to give like a nice contour of the cheek, and I know that I can easily dissolve that.
Just shaking it. I just hear his water ice bouncing.
Yeah. That's how I roll, brother. Who's your ideal client? Like, what kind of skin are we looking for? I know in tattooing, there's like, this is dream skin. Is that the thing in injecting?
That is such a great question.
Thank you.
You're loving his questions.
yeah.
I love his questions.
That's what I do.
I mean, my God. Okay, great question. So I consider myself an artist. I'm in the medical profession, but I'm an artist. Your skin is my canvas. So if you come into me and you've already got this beautiful, plump, hydrated skin, of course, anything that I do is going to look better. So ideally, if I have a 30, 35-year-old, I mean, they're going to have theoretically the best skin, right? I mean, 20-year-olds, I'm not doing a ton of filler on, 20-somethings, but I would say 30 to 35, great, great skin. That's a sweet spot for that. And then if I have someone older, which, I mean, I would say the majority of my patients are probably in their 30s and 40s, I put them on a great skin regimen. I get them in with an esthetician, and I tell them, like, my canvas needs to look the best that it can look so that my injectables, my art can shine. And I can give you the results that I know I can.
That's good. And some people you look at and you're like, oh, boy.
I never do that.
You don't think that?
No. I don't, because I can do something for everyone.
Okay. That'd be great if you walked in and you were like, oh.
I used to say that I can do something for everyone, but
I'm
going to have to change that.
Now, what about like a 90-year-old, though?
I have had one.
Really?
Whoa. Yeah.
What? And like,
she's like, 89, still comes to me. She gets her Botox. She is so cute. She comes in with her little bag, and she's got her glasses and her pearl earrings, and she comes in and gets her Botox.
She
looks
coins.
Great. She pays the coins, yeah.
With
coins, yeah.
Her little change purse.
Yes.
Anything people should do to prep coming in? Like drink a lot of water, I would imagine.
Yeah.
Salt.
Hydrate
maybe like
the
a little
skin.
scrub.
Yeah, just come in with a clean face. It's usually what I like to say. If they come in with makeup on, that's fine. I can, wash the face off. I have to prep the skin anyway because I have to use like Puricin or HibaCleanse, just to clean the skin flora off of, clean the skin. But yeah, clean face. Don't drink any alcohol or take any blood thinning medications. Ideally 48 hours to 72 hours prior, because that's going to increase your risk of bruising. And that does happen. I can always tell when a patient comes in and they're like, Amy, I tied one on last night. I had, a whole bottle of wine. I'm like, yes, I see. They're bleeding everywhere. I'm just like wiping this up. Like, you're going to have a bruise right here.
Yeah.
But yeah, that's a great question. Yeah.
So I'm curious about your fiance.
Yes.
Tell us about what you like to do on him, or what his take is on this.
Oh, yeah.
Yes. Well, he was a complete newbie to this when we met. First of all, men have beautiful skin to begin with. You guys get on my nerves. You probably wash your face with
a lot of sun, a lot of soap, bar soap.
No sunscreen. Drives me insane. And you guys look better with wrinkles. I just don't understand it. And he's the same way. He actually lives in Charleston. So he's out, has a pool. He's out on the boat all the time in the sun. So when we first, started seeing each other, he asked me, all right, what can I do? I want to treat these under eye wrinkles, or what can I do? And I was like, oh my gosh, we have got to do a little bit of Botox. I'm going to get you some skincare, all the stuff. He looks like he is aging in reverse. I mean, he's Benjamin Button.
Yeah.
It drives me insane. Men you guys take to it so well, but he loves it. He looks great. I keep him really natural. One of the ways, I like to treat my men versus women, I like to keep movement in your face. Women, a lot of times, don't want as much movement, but men want to preserve that movement so that people aren't like, you had Botox.
And even like in the nose, I've heard a lot about to balance it out side to side.
Yes.
Is that a thing?
That
Like
is.
fluff it up or what?
No, slim it.
Oh, slim it.
You can slim the nose with.
Really?
If you have nasal flaring, you can actually put Botox in the nose here, yes. And you can, kind of go down. You can also treat the tip of the nose to keep, when some patients smile, their nose points downward. You can place a little bit of Botox here, and it kind of keeps the nose lifted up.
Oh, I've never heard of that one.
It's really cool.
Yeah.
Yeah, it's really cool.
I just got a zit. Should grown men be getting zits? Maybe I was nervous coming into this that you see this thing here.
Yeah, I didn't want to say anything.
Yeah, I was hammering it last night to try to get rid of it.
Yeah.
But should grown men really I didn't think that was a thing. And then
Well, it can be. I mean, it can be. What's your skincare like?
None, zero.
None. There you go. And what's your diet?
No,
God,
don't. I
I had a
mean,
rough-
you do skincare.
No.
You do.
You do
lotions and.
I'll do a lotion here and there. I got a spot right here, but I'm not a routine lotion.
Yeah.
I tried doing jojoba. Is that what it's called? Jojoba?
Oh, that oil?
Yeah.
Yeah. I don't
My
know
wife
much
has
about
that,
it.
and I started doing a little bit of that, but I just don't think it does anything.
Did you just recently start that?
Did
Because
it,
it could have clogged something, and that
Maybe.
caused. Yeah.
That was it was probably 2 months ago that I did it, and
Oh.
I did it. I wanted to see if it changed anything. I did it probably for a good 3 weeks straight. Didn't notice a thing.
Well,
But maybe that's just greasing me up. That's what I think. I
Yeah.
feel greasy.
yes.
And
It
then
clogged your pores.
Yeah.
I like the little thing my wife does that it's like rubbing a roller on her face.
Yes.
Like the cold.
I think it's a
thing.
lymphatic. Is it a lymphatic
Yes,
drainage
it
thing?
is. Those are great. You can get on TikTok and find a whole tutorial on how to do it properly and just do your lymphatic drainage. It helps with under eye puffiness and all of that. Yeah.
And it has to be a special rock of some sort, right?
I don't
Or it
know
doesn't
about
matter?
that. Yeah, I don't think it matters. Yeah.
If you, what age would you shoot for to look like for a woman?
Ooh, good question, right?
Say good question.
I thought that was a good question. I'm telling you, good
I'm
question.
not going to say good question again. What age? Ideally, most women, when they come to me, they're not trying to look. Say I have a 40-year-old, she's not trying to look 20 or 25. She just wants to look refreshed. So, 5 years younger is
Five
just
is
it's a great goal.
Yeah.
Yeah, that's attainable.
Okay.
I would have thought 10.
Well, 10 is ideal.
It's a lot, right?
But that's a lot. That's a lot
If
of
you're
work.
30, you look 20. You don't want that.
No.
Tom, anytime we meet someone new, Tom asks them how old they think I am.
Yeah.
You?
Yeah. Go ahead.
God, you're going to put me on the spot.
That-
Really?
He teed it up. What are we
I'm-
supposed
Yeah.
to do?
I am terrible at this.
That's great.
Everybody
And just
is.
be
That's what
honest.
I'm realizing.
39.
Oh, that's a very good guess.
Wow.
How old are you?
I just turned 40 in April.
Okay, see.
There you go. I'm 5 months.
Yeah.
I'm 5 months
He just
better.
looks 10 years older than me. That's the what.
How
Yeah,
old
the
are you?
problem is you might have guessed. Here's my
32.
worry, though. You might have guessed 5 years younger than you said to be a compliment. So maybe you thought 45.
44.
No, I really thought
44,
no, I really
50.
thought 39.
You did?
Yeah.
Oh, that's a good guess.
Yeah, nice.
All right. Did you do Tom?
What do you think? Just did a little wink.
32.
Yeah. It's great.
What?
I mean,
That is ridiculous.
It's
All
fitness,
right,
it's
we're
skin,
editing
it's
that
the whole
out. I'm
thing.
going to make a
No.
timestamp
That's it.
there.
no, that's right. See? It's just that's the age gap that you and I have that we know about.
Right. I've had people guess. So I've had people guess 54, and I've had people guess 31. So I've
54
had
for
like
you?
yeah, I've had a
you serious?
14-year
Yeah.
over and a 9-year under.
No, you don't. you do not look like you're older than 40.
Thanks.
promise.
I think 40 is kind of a good looking age for a guy too. Like in
100%.
my mind, I think when I'm 50, I would like to look 40. Anybody, even
Yes.
when I'm 60, I would kind of want to look 40, 45.
But men look better when
60.
you age. You guys,
Yeah.
you look better when you age. You
Why do you
look
think
better.
God did that?
I have
It's
no
a good
idea.
point.
I tell my
have
wife
no
all the
idea.
time that, yeah.
It's not
She loves
fair.
it. She loves it when you tell her that, I'm sure.
But do you see how much we're having to do to ourselves as women?
That's
Like we have to
where
do
did that
so
start?
much.
That's what
Not
I think.
fair.
Like, why did it start?
I don't know, but I will say sometimes I feel like social media puts a lot of pressure on
Tons.
females. I have 4 children. My oldest just went to Carolina. I just moved her in this past week.
Ooh.
And just seeing the amount of pressure, she's a beautiful young woman, but just seeing the amount of pressure that she has, it's just, oh my gosh, for women, it is so hard. And I think
Right.
social media plays a big role in that.
She doing the sorority thing too? Because
Oh
that's
my
a whole
gosh.
nother level of.
Yes.
Yeah.
It's a lot. It's brutal. It's
That's-
brutal, but she's loving it.
Yeah.
She's meeting new people and just
It's great.
getting new experiences. And I mean, it's been great so far. We found out on Sunday, so.
Has she ever come to you and said, I want to do a little Botox or something?
She actually is a biology major. She wants to be a physician's assistant
Nice.
and work in the family business when
Oh.
she's So I'm
That's
gonna
amazing.
hire her. In what 6 years or so when she can complete all of her studies. But yeah, so has she come to me and asked yes, and what did I say? No. Absolutely
no.
not. You are 18 years old.
Yeah. Mhm.
Absolutely not. You're beautiful the way God made you right now. You're young. You're youthful. You're fine.
Yeah, that's a good question. What's the youngest person that's come in?
18,
18.
actually.
Like what?
Actually, 16.
Really?
Mm-hmm.
And do you have to get mom's permission? Yeah.
I had a mother come in, and I was
And
like,
wanted it?
nope.
Oh God.
Yeah.
Yeah.
The 18's been the youngest. A lot of the young girls come in not for Botox, it's for lip filler. That's the number
Oh,
one
yeah.
treatment they want. Mm-hmm.
I feel
But
like,
the peak lip age. Sorry, I didn't mean to interrupt
Yeah.
you, but the peak lip volume, I guess the peak age for lip volume is 18. And when I have 18 and 19-year-olds
Right.
coming in, I'm like, you don't need it.
Right.
that's what I thought. For a while, I felt like it got way too big. But now I feel like I can't figure out if lips are getting slightly smaller and more natural looking or if I just see it everywhere and I'm used to it.
That's a great point.
Can't
I
you
think you're
just-
used to it.
Can't you just?
Do you think I'm
make
used
up
to it?
them-
Yeah.
But can't you just use makeup and make them bigger?
Yes.
And that's like,
Yes.
yeah.
Yeah, you can. You can give the illusion. But then when you eat or drink anything, you think it may come off, and then,
Right.
but I don't know. But
Right.
yes, you can. Makeup can do a lot of things.
Do you think straws are good or bad? Because I've heard mixed things from the skin world.
Terrible.
Terrible.
Yes.
Women will come in to me and they'll say, and typically it's my 45-year-olds and up.
Yeah.
They'll say, Amy, what are these lines above my lips? Why do I have these? I've never smoked.
Wow.
And I'll say, do you use straws? Like, are you using a straw when you drink your drinks? And then what is your sun exposure? Those are the things.
Those are
and
the
the other
keys.
things, and the other thing, we have, like, our muscle around the mouth is a circular muscle. So when we're pursing our lips, you're going to create those lines.
Really?
Mm-hmm.
What do you like? Is there stretches or anything that women could do? Like, should they widen? Like, should they do like widening work? You know what I mean? Like, if like that ruins it, wouldn't you
Yeah.
think if there's a way to like stretch it?
No.
All right.
No, just don't use a straw. Number one, put good sunscreen. And then I can do Botox. You can place Botox in the perioral lines above the lips, and it relaxes that.
Are most of them going to the bone? Like that's where you have to go?
No, not
Oh.
with Botox. You just want to get into the
Just
belly
it.
of the muscle. Yeah, so like depending on the area you're treating, depends on your depth.
Okay.
So here in the frontalis, you've got this thin layer of muscle, so you're not going to go
Nothing.
all
Yeah.
the way down. Yeah, just depends on like where you're treating.
Okay.
And probably making out too much is probably bad for wrinkles.
Oh, good make
Like
out
kissing,
sesh.
when you're doing that like person, I was like, actually, probably if they're making out too much,
Yeah, I mean, it could be.
you tell them that's maybe their issue.
Like stop. Like
Put
stop.
it
Put on the
gross.
questionnaire.
Yeah, I guess I could
Average time
ask.
spent making out. Straw usage, making out.
I'm actually going to add that to my list.
Is there anything else hot in the skin space or face space maybe?
The big thing right now is Ariessence PDGF. I don't know
What
if
in
you've
the
heard about
hell
that.
is that?
Oh, it
Let
sounds
me
like
tell you.
salmon semen.
Nope, it's not that. I don't believe in that.
That was
But
insane.
That was like a big thing, like to put on your skin after
Yeah.
microneedling. Well, this is the new thing to put on your skin after
After
microneedling.
micro, okay.
Or you can do the non-FDA approved treatment under the eyes,
Oh, love that.
which is where I'm loving it. But it's PDGF, so it's platelet-derived growth factors. So they're made in the lab. They've been around, FDA approved for treatment of wound healing. And so what these physicians have come to find out is, oh my gosh, like look at the cell regeneration, look at the collagen, growth here. When we apply this, let's try it in the aesthetic world. So they started microneedling patients' faces and placing the PDGF on the face, and they're seeing these great results. Their skin looks better. It's more taut, hydrated, less lines. They've got that collagen production. Then they started, okay, let's look at like the infraorbital hollows here under the eyes. That's like a really big area that my patients come in and complain about. And so they started, non-FDA approved, injecting it into that infraorbital space, and it regenerates that collagen production, and it is beautiful. I just had it done like 2.5 weeks ago.
Really?
Mm-hmm.
Is it similar to platelet-rich plasma then?
Yes.
Just the lab version of it?
100%, and it contains up to not 300,000, but up to 300,000 growth factors.
Really?
So it's just more potent.
Interesting. So if somebody wanted to do their own platelets, can you do that as well?
I do. So I recommend 3 treatments spaced out 4 weeks apart. So I draw their blood, spin it down in my centrifuge,
nice.
and then I inject it under their eyes or wherever.
You do any scalp stuff?
I have when I was at my previous employment, but I have not done it since.
Okay.
Yeah, since being with Nouveau. I mean, I offer it; it's on my menu, it's on my list, but I haven't had anyone
Come in to do that.
come in and ask for it. It's not like a big service that I've done.
What would it be, like dandruff?
No, it's when you draw their blood and you spin it down and
for
get their
hair.
platelets. Yeah, and then you basically you topically numb their scalp, and then I go in and I'm injecting their platelets into their scalp to regenerate that hair growth. Now, it's not for patients who are already bald, like if they've already got, like they're mainly bald, it's not going to do anything. But patients who are slowly losing their hair, yes, it will help.
Nice. Why, so tattoo guns are just needles, right?
Mm-hmm.
Why isn't that used more? Like, I feel like you'd have a lot of control with just like a tattoo gun to the whole face.
What would I do with that?
I don't know. Like, can you put, maybe put some of the like the PRP?
Oh, with that. Oh, I don't know.
See, that might be the new thing.
I mean,
Get,
yeah,
you're just
Yes.
punching blood in instead of ink.
you may be onto something.
Tell the world.
Well,
Also, because I was wondering, where are people doing these experiments? Like these continuing edge, or like when some of this stuff comes out, I'm like, where is that starting? Where somebody's like, oh, let me take some salmon semen, and you know what I mean?
I don't know. I don't feel like it's here in the U.S.
And then so just kind of like overseas, people are in a
Yes.
tent somewhere.
Yes. I have one esthetician. So my business is located within Skin and Brows Redefined. So I operate just kind of out like within that med spa and that space. And there's one esthetician there. She's a great friend of mine, and she is always coming to me. She's actually from Germany, but she has always come to me, Amy, oh my God, have you seen this? Like, we've got to
really?
look into this treatment. I'm like, girl, we cannot get that over here.
Right.
Like, that is stuff overseas. I don't know what they're doing. It's wild.
Yeah.
Like they're doing all of the new and latest things there, and we're just so far behind here in the States.
Yeah.
It's interesting.
Yeah.
So what about different, because as you're saying around the world, I'm sure like different people from different places come in to see you, and their skin is completely different, their pigmentation is completely different, their facial structure is different. What does that look like, learning that dynamic?
Yeah, so it just kind of depends on the amount of melanin someone has in their skin. Like the more melanin you have, the less wrinkles. I feel like their skin is just so much more beautiful. Yeah, it is so much more beautiful. They have less lines, just more collagen. Their skin is just not as damaged, I guess, as, someone with less melanin like myself. I mean, I'm just like a walking sun damage here, but But yeah, it just kind of depends. You
Because
know,
even in Japan, well, here's what I was thinking. Because Japan, there's a big push toward like the bigger eyes, like or bigger lips, or it was some sort of like version of like a something that I wouldn't have thought of.
yeah.
Like looking like a
we might-
cat.
Well, I've seen some people with like the donut. They make like the donut on the. Have you seen
that-
that?
no.
Like with filler, like they do like a.
What would that
donut
do?
What would
on
it-
there.
yeah.
I don't know. It's just like supposed
They
to
have a
be
donut on
you-
their face.
Yeah, they have it like they inject saline. Like y'all haven't
a
seen
circle?
that? They inject it. Yeah, like it looks like a donut on their forehead.
Weird.
Oh,
Yeah, and that was like a thing. It
in
was
a
like
different country,
an
probably
Asia
in
thing.
Asia. Yeah.
Bunch of cultural stuff.
It was
Yeah.
a cultural, yeah. I mean, different people with like ethnicities and whatnot, you know, just depends on kind of what they have. Like, you know, some of my Asian patients come in and they have like larger masseter muscles. So I know that that may be a complaint that they have when they come in. They want to slim the face down. And so I use Botox, you know, in their masseter muscle, and it helps to slim that face down. So it just kind of depends on, you know, what they have.
Yeah.
Nice. How long? And Botox lasts how long?
It's if it is dosed appropriately, you're going to get 3 to 4 months duration.
Okay, nice.
It's not an immediate thing, and a lot of patients that come in, you know, expect their results to be, you know, the next day. It's going to take an average of 5 to 7 days to start working before you know, you start to
Oh.
see results in the mirror. And then by the time, you know, 2 weeks has passed, you know, full results, then, you know, 2 to 4 weeks, you're really seeing your full results. And then your movement starts to return around week 9, 10, and just slowly starts to come back. So around 3 to 4 months.
Yeah. Is there like a numbers competition where like somebody comes in and they want just a ton of Botox in,
That's great.
like competing with their friends?
Well, they don't do that. A lot of patients come in and they get offended if I'm like, okay, I think that, you know, to give you optimal results for what I know I can do and how you can look your best, this is what I recommend. And I may say, I recommend 60 units. They're like, oh, no. Like that.
They want
get
more.
No, they get offended.
too
Like they
much.
don't think, no,
Really?
they think that is too much. Like they're very caught up on the number of units they get
Right.
versus what kind of my professional opinion is. But they trust me. They know I'm not going to let them look frozen or
Right.
look crazy. You know, and dose equals duration. So the more units I place, the longer it's going to last and the better the results are going to be.
And then what's your treatment zones? Like, do you have a starting spot? Like, do you start at the forehead and work your way down, or what's the?
Well, it depends on the patient.
Okay.
So
Like, let's just say there's a girl named Rachel as a patient. What would you start with her?
So, yeah, I mean, I know a few Rachels. So I like to come in, and when Rachel comes in, I like to get a mirror and say, all right, Rachel, when you look in this mirror,
Yep.
what part of your face do you want me to work on?
Yep.
Like, where does your eye go? And that's what I want to start with the patient. And then when they've built trust with me, I like to make other suggestions. Well, if I'm treating this area, I also want to treat here, and this is why, because it's
Right.
going to, you know, come off, you know, play off of what we do here. But I would say the forehead is the top treatment choice. Women do not like these forehead wrinkles.
I don't get it. Like, I don't know if I ever look at forehead wrinkles.
Yeah.
Should I look at them
I
more?
think you would notice it.
Would I?
Yeah.
Well, so here's the difference between men and women is if you held up that to me, I'd be like, oh, I look good. Like I would
Yeah.
just,
Yeah.
it wouldn't matter how bad I looked. In reality, I just think that I look good.
Yeah.
Everything looks good. You just want to look better.
Yeah.
Yeah.
Well, I'd be
like,
like,
oh.
no, that's where I'm like, listen, I need your help because I see nothing.
Yeah. Well, anytime you want to come in.
I'm
Yep.
just kidding. That wouldn't be the case.
Yeah.
But I do think like looking at things yourself, some people are just so, I guess, focused on little things. Like they notice all the details versus some people are just like, this one area right here is the only thing that I notice.
Well, I tell my patients that you're the one in the mirror. Sometimes I have patients that come in and they say, Amy, don't you see this? And I truly do not see what they see.
Oh, like
I
what?
don't. I mean, it just depends. I mean, okay, here's an example. Patients that come in, this is what your iPhone will do to you. When you take a selfie and you are looking at yourself with your iPhone and you are holding up that camera, you are distorted. And patients are coming in and they're saying, why do I look different? I'm asymmetrical, or I have this. And it's distorting their perception of how they really look, because when they look at themselves in the mirror, they see one thing, and when they do a selfie, they see another.
Right.
So then they're coming in to me and saying, Amy, I need you to treat this. Like, this side of my face sits up higher than the other, or I've got, this lip is lower than the, this side's lower than the other. And so that's my job, to kind of redirect the patient and say, listen, I split the face into 2 sections. They're sisters, not twins. We all have asymmetries. We're not supposed to be perfectly symmetrical. Or they'll see, lines that I just don't see, and I'm just not going to treat it. I'm not going to waste their money, if it's not something that needs to be corrected.
Nice.
Sisters Not Twins would be a good T-shirt.
Yes. Oh, I should do that. It's actually a really good idea.
Nouveau. What's your face routine, and who does your work? Are you doing your own?
I do some of my own work.
Wow.
When one of my best friends, Ryan Baker, cannot do it. So I get Botox 4 times a year. And I get treated all over. I mean, I've got Botox in my forehead, my crow's feet, my chin, my depressor muscles, my neck. I think that's it for Botox. And then
Is that 60 units?
I do probably like 70, 80 something. Yeah.
Per sesh.
Yeah. Just
I don't even
because
know what's high.
Well, I mean, that's
Like, what's low? What would be a low dose?
I thought it was
10?
like 8.
8.
Yeah.
What's
8 units?
8 units.
8 units does nothing.
Nothing.
You're not gonna-
You know what? If someone came in to me and they said, Amy, I have enough money for 8 units of Botox, we would treat their chin. Or I would give them a lip flip.
Oh.
Yeah, you have to think of like the muscle size and kind of how strong the muscle is. So I have to dose it, appropriately for that. But yeah, no, 8 units is not anything. But you can, like I said, you can treat a chin or a lip flip. But yeah, Ryan does my work, or like I said, I can touch up my own stuff. And then, of course, I have filler in my cheeks and my lips. So.
Nice. What's the sensation feel like? Like, do you numb somebody, or do they feel like a prick every time?
With Botox, you feel that.
Oh,
so
really?
I do not numb with Botox. So going back to my patient Rachel, every time Rachel comes in, she thinks that I'm just hurting her.
Yeah.
But
She's soft.
70 pokes.
Is she pretty soft, Rachel?
She is pretty soft. She's
Yeah.
kind of a wimp, I would say. But yeah, no, Botox is not painful, but it can depend like where a woman is on her menstrual cycle. Which is a thing. So your pain receptors are a little bit different then. So if a woman is on or near her menstrual cycle, it tends to hurt a little bit more. And the other thing my patients say is the left side of the face hurts more than the right side of the face. I don't really know why that is.
Probably Mercury's in retrograde, I would imagine.
And I'm thankful Mercury went out of retrograde today.
Oh, really?
Oh, yes. I have been going through it.
That is wild.
But yeah.
That's great.
Yeah.
So what, I guess, on their menstrual cycle, is there an ideal day, or just kind of, we don't?
Ovulation has to be the best.
I mean, yeah.
Randy says his wife's like lips fluff up and her
Yeah,
skin
skin
looks-
is soft.
Yes, that's a thing though. Women look better when they're ovulating.
They want it.
Yes, because when you're in,
100%.
yes, because when you're on that second half, like you ovulate and then you're done and you're releasing your egg and you're doing your stuff, like whatever, you don't look as good. You retain water, your eyes are puffy, you're moody, you're not sleeping. It's a real thing. Your Botox hurts.
Yeah. So probably you got to schedule around that. That's good.
Yeah,
See?
ovulation. That's the best time for
Fun
Botox.
fact.
Yeah.
Sunscreen. How much are you lubing up, and what? What's it called?
SPF.
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 What SPF are you going?
I'm 75.
Wow. You're not even outside at that point.
No, because you still need sunscreen. I don't care if I stay inside all day. UV comes through your windows. You have got to place sunscreen.
So
Yes.
you don't like sun at all. No sunlight.
No, and this summer I have been in Charleston almost the entire summer on a boat or at my fiance's pool and just at the beach. And I told him, yes, but I told him, I said, I cannot do this again. I've got so much melasma and like all the things. Sunscreen is a must. If you're going to get injectables, you need to invest in your skin. You've got to look good. You've got to just protect that skin because it's just going
Yeah.
to make the injectables that I do look better.
Now, are you going spray to hit all the areas? Or are you going?
No.
You're going
Lotion.
Wow. Who hits the back? Fiance?
Yeah.
Rachel, maybe occasionally.
Rachel does when I'm with her. Yeah.
We have a friend that has great skin, Mark Losby. Anytime we do a esthetician or skin person, we always have to bring him up.
Yeah.
And the joke is like, who gets to rub lotion on him when it's, his skin is just,
What's he doing?
that's the thing. There's got to be something.
Is he gatekeeping?
He
You won't
is.
tell? Okay.
That's why we brought it up earlier, because we think there's something he's doing.
He says he
just
drinks a lot of
water.
water.
Yeah, water is what he says.
Okay.
So that's usually how we introduce him. Like, this is my friend Mark. He
All right,
has
I'm
a
gonna
really
look
good
him
skin.
up.
Yeah, he's
I
got
want to
good
look
skin.
him up.
He's like Swedish, I think. Like his,
Okay.
you know,
Yeah.
no hair on his body. So that probably helps. It looks better.
Okay.
Right? He's not getting snagged on things. All right, who does your social media? Are you you're doing it all?
Oh, yourself.
I do everything.
Nice.
Yes, I do everything. I schedule, I do my social media, I inject, I run my business, I order, I stock, I clean my room,
Yeah.
pay the bills.
I feel like your daughter might be able to help you with that.
Well, I've actually hired her, but with her being, starting college, we're kind of taking a pause with that. But yes, that's kind of my goal for her because I want to so I've got Instagram, so I've got I've got my business Instagram, and then I've got my fun Instagram. And then I want her to kind of take over that aspect with my business, and I want to do a TikTok. I want to have a TikTok account.
That's if we feel like we would crush at TikTok, and we have some stuff out there, but I don't understand it.
Oh, I love
and
TikTok.
people do you order from TikTok? Like
I
was
have.
told, really? That just seems wild to me. I don't know
I know.
why.
It's scary because then I'm like, oh my gosh, is my card going to be hacked?
But you do
know?
it anyway.
But I did it.
Yeah.
I've ordered twice.
And it worked.
It was fine. I mean,
So it's kind of like
came in.
Amazon where like you saw something, you clicked it through TikTok, it shows up.
And it did Apple Pay, and it went right through.
Wow.
And it's delivered to my door, like within a week.
See, that's nice.
Yeah.
I didn't realize that was like that. It's a search engine. That's like, it's everything at this
Yeah.
point.
Yeah,
Okay.
I love it. But yeah, I have to get into that avenue. And then I was told at an aesthetics conference recently that I need to get into YouTube.
Yeah.
Like do a YouTube
Shorts.
channel. Yeah, but I just
Yeah.
haven't had time.
And then what's your typical hours that you're working? Kind of like a day in the life, maybe?
Yep. So I typically work 10 or 11 until 4, Monday through Friday.
Nice. What are you doing before 10? Just hanging out?
Yes. I mean,
Little workout, maybe?
I try to work out. I go to EQ Fitness.
Oh, good.
And then I'm also a member of One Life. So occasionally I'll go with my friends.
Nice. Yeah, it's cutting out.
Yep.
Well, EQ's great. We had Wes and
Yeah,
they're
unreal.
great. Wes-
And One Life's great too. We've been doing a lot of stuff with them too.
yeah.
Love it.
What's the vision for the biz? Just kind of keep it cranking. Do you want to bring anybody in? Do you want to duplicate?
That is very interesting. So I actually have 2 locations. My main location is here in Columbia. But so I've recently been hired as an allergen trainer. So I'm training new practices, new injectors on Botox and fillers. I'm the only trainer in South Carolina. So because I'm going to be away from my business, I'm actually interviewing
Right now.
tomorrow.
So you're bringing in like nurse practitioners or
Nurse practitioners.
PAs. That's what they need to be.
I want a mid-level provider because I don't want to have to be present
Right.
to supervise.
Yep.
So yeah, I will be, going through the interview process, trying to find that right candidate, and the right person for my business because
Nice.
this is my baby. This is my baby. I'm going to be very particular in who I hire, but I know that I'll find the right person.
What kind of interview questions are we thinking here? Do you
Oh my
need us in there?
gosh. Yes.
We do things like
Thank you.
how many push-ups can you do?
Yeah, that would be
how
great.
fast do you run a mile?
Yes.
Those
I mean,
are
all of those things would be great.
Yeah.
Yeah.
You let
nice
us know
to-
if you need us to FaceTime in and
I will. Yep.
fire them a couple.
Yes.
It's nice to see if they can joke around with your sense of humor.
Yeah.
Yes.
That's always the tough thing.
I know.
If they
The
interview,
vibe.
say all the right things, but you don't make them feel uncomfortable. You don't really know how they act when they get uncomfortable.
And that's the thing. Like, I want the person to be the right fit. So I want to have them come in. I'm not going to just hire on the spot. Like, I want them to come in, talk to me. Let me hear about your goals. Like, what are you looking for? And then I want them to come work with me a bit. Like, just make sure our personalities are great, because I'm very protective of my brand and my patients, and just want to make sure I've hired the right person.
Nice.
Yeah.
Do they need to like bring in clients too? Is that like important, or is it more?
No, I mean, because they'll get that. I mean, when I started, I was brand new
Yeah.
to the game. I worked my way up from the bottom up, and I think that I've been very successful. Over the past 6 years injecting. So I mean, I will give that person leeway. If I end up hiring someone who is experienced and has clients, great.
Yeah.
I mean, that's great.
Even better.
But I don't have they don't have to be injecting now and be able to bring that in. They just need to hustle.
Yeah.
That's the thing. It's a business. We got to make money. You got to hustle.
Oh yeah.
Yeah.
And I guess I wondered that. What would be marketing like? Would you go to events and just do some injections to kind of, or how do you normally, like if somebody was starting from scratch, what would be your advice to them to actually get their first couple clients?
It's a lot of times it's going to be word of mouth, and you're really going to start injecting your friends and family.
Yeah.
And that's just kind of how it is. You can go to local businesses. You can give them a business card and say, hey, my name is Amy, and I'm a new nurse practitioner injector with Nouveau facial aesthetics, and I'd love to have you come in. I'm going to offer you $2 off your Botox if you come in, and then we'll give you X amount of dollars off for a referral. If you send in some clients. So a lot of it is word of mouth, and then social media.
Yeah. Great.
Love that. All right, this is my last question then.
Okay.
What's your like core values or kind of like guiding principles when you're in your business and then when you're hiring someone?
Yep. So I want to make sure that whoever I hire keeps my patients looking natural and just kind of preserves the patient for who they are and doesn't try to change them. I think that we need to be as conservative as possible, within our approach to how we treat our patients. Be kind, be humble, be approachable. Don't be intimidating to others.
That's great.
Yeah.
Is there an ideal celebrity face that you're into? Female
Ooh, and male.
and maybe male.
Okay, Scarlett Johansson, I think, is so stunning.
Yeah.
Good choice.
I think she's stunning. Yeah.
Yeah.
Male, I don't know. Jude Law.
Jude Law, old school.
I'm 46. What do you expect? I'm older than you guys.
That's great. I didn't see that.
That was a good answer.
What did you expect?
No, that's a good answer. I
Yeah.
just wouldn't even have thought of him.
Well, I'm old.
Yeah.
So, I mean,
You look good for 46.
well, thank you,
That's
Botox.
great. Yeah.
Thank you. And skincare.
Yeah.
Thank you so much for being on
Yeah.
the show. Everyone go
Thank
check
you.
her out.
Thank you.
We're here for the health of it.
For the health of it.